Yes, friends, very good morning to everybody. So, welcome back to Rama Sharma's International Pharmaceutical Marketing and Training YouTube. Hope you are enjoying the videos. Today, we will discuss about excretory system. As a medical representative, you have to know brief about this system because drugs are excreted out through excretory system. So sometimes doctor they ask you if there is a kidney functions compromised, should I adjust the dose? So from that point you should have idea about excretory system. So excretory system is composed of one system which is the urinary system. Okay, so in urinary system there are organs like there are two kidneys, you should be two kidneys, and kidneys are made up of the unit we call as nephron. This is the picture of a nephron. So outer part is the cortex, then there is a medulla, and then there is a pelvis of kidney, and then this comes out down. There is a ureter, okay, which is a long tube. So blood is filtered in the kidney, okay, and the urine is made here, and then this drop by drop comes down, and this is accumulated in urinary bladder. When it is full, you say, sir, I want to go. So go. So urine is thrown out. So urinary bladder, and there is urethra, okay, and which is outside this throws the urine. Remember, urethra is small in female, 1.5 to 2 inch, and in male it is longer. So this is one urinary system or urinary tract, one part of excretory system. Next is the digestive system. So digestive system is also part of excretory system because food we have discussed is ingested, digested, assimilated, and ultimately defecation. So whatever is the waste we throw every morning, evening, or whenever it is there, so that you throw out waste material, including drugs also. So that is a part of digestive system, excretory system. Then next is the skin. Skin is also part of excretory system. Through skin, the salt and water and even some drugs are excreted out. So that is also part. And then last is the respiratory tract. It is also part of excretory system because through lungs, the carbon dioxide and other obnoxious substances, metabolites, including some drugs, are excreted out through respiratory system. Even some cytotoxic drug, I think probably 5-fluorouracil partly is metabolized, is excreted through respiratory system. Okay, so excretory system has these are the organs. Okay, coming back to nephron, remember that nephron is the unit of kidney. It is very simple unit. The blood goes inside. There is a there is a capsule we call as Bowman's capsule. So there is here the arterioles and smaller arterioles, and ultimately capillaries, which is single cellular structure. Okay, so up to this level it is there. It is a mesh. It is a tube. It is a tubes of arterioles. So blood goes inside, and remember the diameter of blood what goes inside is little larger, and what comes out diameter is smaller. So a pressure gradient is maintained. See what God has created. So with lesser pressure blood goes in, and with more pressure it comes out. So the inside there is a pressure. So with that pressure now the things are excreted out, particularly proteinous metabolites of proteins, your creatinine, your uric acid, all they are excreted out here, and then including water, filtrate water also, 70-80% will go, and then it will be reabsorbed. So Bowman's capsule, and inside we call as glomerulus. So there is something you should know, glomerular filtration rate, whether kidneys are working properly or not, we know by this. Okay, so Then filtrate comes down. This is loop of Henle. So there is a descending loop and then ascending loop, and here that is the collecting duct. So here what is the filtrate? Ultimately the urine will be coming out and then it will come out. Okay. So as a medical representative, what you should know is that if drugs have dual or multiple route of excretion, then dosage adjustment may not be required and they are safer choice. And some, if they have only one route, many drugs, they are excreted down only through exclusively more than 90% through urine, then dosage adjustments are required. For example, aminoglycosides, gentamicin and amikacin, ethylmycin, all mycin, this, aminoglycosides. So they are excreted out through only urine. So if kidney functions are compromised, you have to reduce dosage. Otherwise, there is a risk of nephrotoxicity. Okay? So, some drugs have dual route of excretion. For example, tetracycline, doxycycline. It has a dual route, kidney and also through digestive system. So, because of dual route is a better renal safety. So, even if kidney functions are compromised, dosage adjustments are not required because drug will be diverted. If kidneys it is not able to excrete, digestive system through biliary tract and that it will be excreted out. So, there is a renal safety. Okay, so this you should know. And remember, if kidneys are properly functioning or not, how do you know? Very simple. One test doctor they do is the GFR, glomerular filtration rate. So they accumulate the urine and they observe how many ml has come in what period, and then they decide it. If they cannot do that, they not only that. For example, creatinine is one of the very the important metabolite of proteinous metabolism. So they will see the creatinine. What is the rate? So there is a creatinine clearance rate, CCR. So they accumulate urine, check the creatinine, how much it is going in 1 hour or 2 hours, then they decide the function of the efficiency of the kidney. Okay, CCR, creatinine clearance rate. Suppose urine is not coming, or if it is not in ICU or in coma, patients is not able to have enough urine, from blood also they can see creatinine, serum creatinine concentration or level they can see and say now kidneys are properly functioning or not. And if kidneys are not properly functioning, they can use outside mechanism. So this Bowman's capsule glomerular filtration they will use outside. So they will connect blood to the machine. Okay, and the blood goes into the machine and machine filters the blood, throws waste products, everything, filters the blood and give back to the body, and that is what is nothing but your dialysis. So what is dialysis? Blood goes in machine, it filters and puts back. Simple. Okay, so it is dialysis. Now the indications which generally you will use, put itis everywhere as we have discussed. Suffix. Okay, so if it is kidney, it is kidney. Kidney means nephron, so it is nephritis. If pilus also is infected, then pyelonephritis. Ureter, uretritis, and urinary bladder is cystitis. Cystitis. Okay. If it is gallbladder, remember cholecystitis, because chole is the prefix for gallbladder. So cholecystitis, it is cystitis. Urethra, urethritis. These are simple itis, you put it everywhere. So friend, this is excretory system, and I think this is enough for you. From the point of medical rep, this much is enough. You don't need to go much deeper, but this is superficial information enough for you. Okay, so with this, thank you very much. Have a good time.